Hello people, in this video let us look at this tympanic membrane perforation. So basically we are focusing more on traumatic perforation, some trauma to the tympanic membrane. Otherwise, what are the reasons that tympanic membrane can get perforated? Because of otitis media, etc. So anyway, so this is the tympanic membrane. It is the boundary between the external ear and the middle ear, isn't it? So are you able to see the tympanic membrane? Here it is, right? This is the tympanic membrane, the eardrum. Now, what and all trauma can cause a perforation in it? So let us say Q-tips like these, right? Trauma due to hairpin, matchstick, right? Unskilled attempts to remove a foreign body. So if there was a foreign body and they try to remove it, unskilled, not the professional, but at home they just trying to do something and remove it, they can perforate the tympanic membrane. Then sudden change in air pressure. What is a sudden change in air pressure? Like a slap. A slap can cause a sudden change in air pressure, isn't it? So here depicting a slap, sudden change in air pressure. A kiss on the ear, that is really strange, isn't it? Where is this? A kiss on the ear where there is sudden pressure, change in air pressure. Then a forceful Valsalva. So a Valsalva is done for what? Eustachian tube, right? For patency, to open the Eustachian tube. So, but a forceful Valsalva may rupture thin atrophic membrane. That means if it is already thin and atrophic maybe, then it can get ruptured by a forceful Valsalva. Otherwise, Valsalva should not be dangerous, but here they are telling is a forceful Valsalva, right? So, basically what do they do here? They close their nose and they try to swallow, isn't it? Or you can say they hold their nose and they try to blow a balloon like that, right? That is Valsalva. Okay. So all these can also cause traumatic rupture of the tympanic membrane. Okay. So what are we looking at? Traumatic rupture of this tympanic membrane. We already saw two reasons. Okay. One is hairpin, matchstick, etc. Then air pressure. Then fluid. Pressure by fluid. Again, this is air pressure, this is fluid pressure. So first they talked about air pressure, now they're talking pressure by fluid. Isn't it? So pressure by fluid means like in dive, if people dive into water sports, forceful syringing also if it is done, right? All that will cause this rupture of tympanic membrane. So how's it going, guys? So this is what we are trying to look at. This is tympanic membrane, you can see here. Here it has got ruptured, right? Here also you can see a real diagram of the rupture. So we are looking at the causes. So fluid pressure over. Then lastly they are talking about fracture of temporal bone. So if temporal bone is fractured, then that can also be in addition to the tympanic membrane rupture. Okay. So now let us look at the treatment for tympanic membrane rupture. So it is called as it repairs itself. It can heal itself if it is small, right? And what else they have written here? It can repair itself. What do you think? So then majority of cases the edges of perforation get inverted towards middle ear. So edges become inverted towards the middle ear. In such cases the ear should be examined under operating microscope. So they will examine the ear under operating microscope and the edges of perforation they will reposition them and splint them. Okay. So anyways, what you have to know here is these edges, whatever edges they showed here, these edges they will be turned towards the middle ear, isn't it? Then they will under the operating microscope what they will do, these edges, this is the edge, isn't it? All these edges they will reposition and splint. So they will bring them back together and splint it. Okay. So basically that is one thing. Then basically there is something called as Myringoplasty, right? That chapter you can look at, Myringoplasty, where tympanic membrane they are trying to restructure. So Myringoplasty is what? Reconstructive procedure it is limited to the repair of the tympanic membrane perforation. Okay, this is concerned only with tympanic membrane. But when you talk about tympanoplasty, then there will be even the ear ossicles, even the bones, ossicular reconstruction can happen. But here myringoplasty, only tympanic membrane. Remember this. What is myringoplasty? Reconstruction of the tympanic membrane perforation or tympanic membrane alone. But what is tympanoplasty? Tympanoplasty is where you can have the tympanic membrane plus the ossicles. Ossicles also you can repair. Okay. So what are they telling here extra? Injuries of tympanic membrane may be associated with facial paralysis. Okay. So there can be, if there is facial paralysis, subluxation of stapes, that is the ossicles, the ear ossicles, the bones. So there can be vertigo, nystagmus, sensory neural hearing loss. All these are some extra symptoms. In such cases, urgent exploration may be required. So these one all will be emergencies where it is not just a perforation. There are other things like a facial paralysis, vertigo, nystagmus, right? Then that will require immediate exploration. Hearing loss. Okay. So what did you understand in this video? So in this video, we tried to look at traumatic perforation of tympanic membrane. What could the causes be? Right? What could the causes be? Then we looked at how they look and we looked at the treatment. Okay. So basically to repair this hole, right, they can also use a graft. So they will apply a graft. The graft will usually be fascia, temporalis fascia, temporalis muscle, that fascia they will take and apply the graft. This is most common. So temporalis, right? Temporalis fascia. Okay. And again, there in this there will be like two methods: overlay method and underlay method. Okay. Or you can say underlay and overlay. Right? Underlay and overlay you can say. Based on whether you are keeping it after the annulus or before the annulus. Yes, when it comes to this traumatic rupture, right, they're talking about splinting only of the tympanic membrane, not about graft. Okay. So just look at the splintage. Splintage is like used in fresh traumatic perforations. So what they will do, whatever has towards the middle ear, right, they will take them, they will evert them and splint them with adsorbable gel foam. So what are they talking about? The edges. The edges, they said they would have turned towards the middle ear, isn't it? So they will evert the edges, right, and they will splint with adsorbable gel foam placed in the middle ear. Where will they place it? In the middle ear they will keep the gel foam. So let us say they keep a gel foam here. We will make it white. Okay, we'll make a white gel foam. So they are keeping a white gel foam here in the middle ear, and all the edges they have everted. So how will the everted edges look? Something like this. All the everted edges. They have everted the edges. Okay. Smaller tears can be splinted on the outer surface of the tympanic membrane. So if it is a smaller tear, they can splint it on the outer surface itself with this gel film, cigarette paper or silicone sheet. But if it is not small, then they are keeping the gel foam inside, isn't it? Just look at the textual content here. Smaller tears can be splinted on the outer surface with a piece of cigarette paper. What is this? Cigarette paper, gel film or silicone sheet. So did you understand this tympanic membrane perforation? We spoke about one particular technique, splintage.